Hi, my name's Suzanne Gornell. I'm a clinical trials nurse at Memorial Sloan Kettering Cancer Center, and I'm here today to discuss with you what some of the common side effects you may experience with targeted therapies. Some targeted therapies in kidney cancer are tyrosine kinase inhibitors such as sunitinib, axitinib, pazopanib, and cabozantinib, and the others are mTOR inhibitors or mammalian target rapamycin inhibitors such as Afinitor and Toracel. Some common toxicities of TKIs or tyrosine kinase inhibitor are fatigue. This is a very common side effect we see with these medications. We typically suggest to patients to separate their activities, encourage hydration, monitor their CBC or their complete blood count for anemia, which is more typically a side effect of the cancer rather than the drug, but trying to figure out why you're having fatigue. And we also monitor your thyroid function because hypothyroidism, which causes fatigue, is a common side effect of these medications. We also always want to rule out depression. Patients have a lot going on with the diagnosis of cancer and now being on a new treatment, so that's something we want to rule out as well. Hypertension, high blood pressure. This is a very common side effect of these tyrosine kinase inhibitor. We suggest that you monitor your blood pressure every day and keep a blood pressure calendar and call your physician if your blood pressure goes higher than the parameters that they've given to you, or if you have any signs or symptoms of hypertension, such as a headache. Initiating an antihypertensive medication is very common while patients are on this treatment. Or if you're already on blood pressure medications, we might need to adjust the medication that you are currently on. You should often be followed by either a cardiologist or a nephrologist when you're having any of these issues because hypertension can affect your kidney and a majority of these patients have one kidney. It often does not require a dose reduction of these medications if you have hypertension, but just managing it to be able to keep patients on treatment. Diarrhea. This is a very common side effect what they see with these medications as well. Antidiarrheal interventions such as loperamide and a diphenoxylate with atropine. If that's not working and you're an overwell healthy person, on occasion the physicians will need to write you for a tincture of opium. Diarrhea is very common. We give patients a heads up. We let them know that they might need to do some dietary modifications, eat a more bland diet, although that doesn't always help. They should stay well hydrated because, again, it's easy to become dehydrated when you're having diarrhea and you have one kidney. So you need to keep your medical team in the loop and take your antidiarrheal medication as directed. More often than not, medications do not need to be dose reduced because of diarrhea. Usually when people are having uncontrolled diarrhea, when we review with them, it's that they're not taking their antidiarrheals effectively or as directed. Hand-foot skin reaction. This is a side effect we see with these drugs, which is unique to these medications. It's something we hadn't often seen in the past. It's a painful callousing of the hands and the feet, could be either or. So it's a callousing that could end up then peeling. Some palliative interventions that we suggest are keeping your hands and feet moisturized, using clobetasol or lidocaine patches for the pain. So usually these calluses start in areas where you already have callousing. So we recommend that patients wear gloves when they're gardening or golfing. Women should try to avoid wearing heels for any length of time. And you should always have shoes on, whether it's flip-flops, slippers. You should not walk around barefoot. Keep your hands and feet well moisturized. Do not shave the calluses or go for a pedicure to have them shave them off because we want to avoid infection. If your physician refers you to a podiatrist, absolutely you can do that. Again, more often there are treatment delays with this type of side effect as opposed to dose reductions. And we've also seen with patients that are on continuous tyrosine kinase inhibitors, they're self-limiting, meaning even though you're staying on the same dose of medication, they do improve on their own. But if it's really intolerable, we can hold your medication and restart at a reduced dose or at the same dose. In tyrosine kinase inhibitors, we often see a mouth sensitivity. We call it functional stomatitis. If you look at your mouth, you're not really seeing any sores, but it feels like you burnt your mouth on pizza, and it can sometimes change the way things taste. We really recommend just using possibly a sensitive toothpaste or mouthwash without alcohol, and adjusting your diet accordingly if things are tasting funny. Some common side effects of the mTOR inhibitors, like Toracel or Afinitor. Stomatitis again, but different than that with TKIs. These are more like canker sores. We typically advise patients to rinse their mouth with salt water, and if it's interfering with eating or drinking, to give us a call. And there's medicated prescription creams that we can call in that can help them heal quicker and also numb the discomfort. Fatigue, same as it is with tyrosine kinase inhibitors, same with diarrhea and the same management. A skin rash is also possible, but different than with TKIs. It's a more generalized body rash and often itchiness or pruritus of the scalp. Again, we suggest moisturizing, and we'll often refer you to a dermatologist for management, and they could give you a special prescription shampoo to help with that. If it's extremely bothersome and it is all over your body, you want to make sure you're letting us know and not managing it on your own, because it can be an allergic reaction to these medications. Letting your care provider know all of your side effects is very important so that we're able to assist in managing them and giving you the best possible quality of life. I hope this information has helped you today. Please be sure to contact your nurse or physician to let them know if you're having any issues. Thank you and have a nice day.